Okay, so today we're going to be doing block 2 skills of phlebotomy. So we have our actors here who have nail polish on, but like said in a previous scenario, this is the end of their semester, so it would not be permissible for you to have nail polish on in the lab or clinicals.
Standard protocol for checking orders, ID, infection control, positioning.
Alright, we have an order to get some blood for an A1C test. Gathered all the supplies. Hi, I'm Victoria, your student nurse today, and we are here to do a little blood draw because we want to make sure your A1C is in check before we discharge you or anything. Can you state your name, birthday, and any allergies you possibly have?
Joan Smith, 85XX, and I am not allergic to anything.
Awesome, perfect. Let me wash my hands and get everything put together, and we'll make this as quick as we can.
Gather supplies, venipuncture needle, vacutainer holder, correct specimen tubes, alcohol wipes, tourniquet, gauze 2x2.
Okay.
Explain procedure to patient.
Alright, it's just going to be a quick little pinch. I just have one tube to fill, and then once it's done, I'll put gauze, tape it down for you, and then we'll be good to go.
Attach needle to vacutainer holder. Apply tourniquet 3 to 4 inches above venipuncture site selected. Palpate distal pulse. If not present, apply tourniquet more loosely.
Tourniquet on. Not too tight. We're going right here,
Select vein.
and pulse is there.
Cleanse site with alcohol swab or required antiseptic solution, moving from center outward in a circular motion. Use friction.
Alright. Scrub.
Place correct specimen tube resting inside vacutainer, but do not puncture rubber stopper.
And now I'm going to put some gloves on before I stick them. You can also put gloves on before you go and touch their pulse and everything.
Stabilize vein with non-dominant thumb. Insert needle into vein at 15 to 30 degree angle.
Make sure your tube is in the holder. And stick.
Push specimen tube into needle of holder.
And we got blood.
Look for blood return. Fill tube, keeping needle stabilized.
Alright.
After specimen tube is filled, remove tube and insert additional tubes as needed. Gently invert tubes up and down to mix after filling.
2.
After last tube is filled, release tourniquet.
We only needed the one today.
Hold folded gauze pad over puncture site and withdraw needle from vein.
Holding.
Apply pressure with 2x2. Activate needle safety. Tape gauze in place with pressure.
There's the beginning. Stick that there.
Label specimen tubes with patient name, MR number, date, time, and your initials, or use pre-printed label. Place labeled specimens in biohazard bag. Put completed requisition in outer pocket of bag.
Alright. Label into the tube and into the bag.
Discard needle and appropriate receptacle. Discard gloves and wash hands.
Alright.
Dispatch specimens to lab, document procedure.
Alright. Patient tolerated well, and we got the correct amount of blood required for the A1C test.